Here at KSMO Radio, it's time for our spotlight on the Salem Memorial District Hospital. We have Don and we have Doug. It's the Don and Doug show. I kind of warned you guys about that, but we're going to actually have Ashley with us too. So things get better all the time. I always love Ashley. She's wonderful. Very, very, very knowledgeable and gives us a lot of information. So welcome, gentlemen.
Thank you.
Appreciate it. And, of course, we're talking about the Board of Directors meeting from the Salem Memorial District Hospital from Tuesday night. Doug, as you kind of warned us last time, some money was coming in, and, yeah, it was nice to see that. Unfortunately, the month of February, not one we want to talk about, but look at the crazy weather we had, basically shutting down Salem for 2 full weeks in the middle of February, and it's a short month to begin with. So it really had its effect on the numbers, didn't it?
Definitely did. Definitely on the volumes. If you were to look at our inpatient volumes in all of our outpatient, even the ED, we did see significant reductions, probably back to what we kind of saw back in December. Happy to report that as we've gone into March, those numbers have gotten to much better. We continue to promote what we call the swing bed program.
Right.
Again, those are for patients that are still needing medical care, not quite at the acute level, but they still need to have some hospitalization. And obviously, average length of stay for those folks is generally somewhere between 9 and 13 days compared to an acute patient, which is 1 to 3 days.
So the swing bed is very, very important and critical, and I know that in talking to Bill and stuff, and he was really wanting to concentrate on that, and you can see those numbers rise. But all the services, we will go through a little bit of that today, where we're finally getting back almost to norm. Still have a couple things to do, but it's there has to be some adjustments made, and that's what we're kind of going through right now. And nothing you can do about that. When you have to make changes, adjustments have to be made. So in getting the extra money in, phase 4 monies, the money from the state, finally they released that money that I know the hospital's been waiting for. It was a welcome relief because, as was brought up at the Board of Directors meeting, fiscally the hospital was, I won't say treading water, but when you get down to 19 days of cash on hand, that's a little bit scary.
Right. Well, if you remember back, our January closing numbers were 19 days cash on hand on average. As we rolled into February, again, the monies hadn't come in yet. There were significant things that were concerning to all of us. One of the things was obviously the board wanted to bring in RHG to take a look at the operations. They joined us. Obviously, the month of February was a transition period for us, but as you stated, much of the dollars that we had talked about since back in November, the first being the American Relief Funding, most hospitals throughout the country got their money back on November 23rd. Obviously, we didn't get it in November, we didn't get it in December. A lot of reasons for why that didn't happen. Didn't even come in January, but we did get that money in, and it was well over $1 million. On the heels of that, came the Phase 4 funding, another CARES Act funding mechanism the government provided, and again, we received over $1.2 million associated with that. The third area of cash inflow during the month was the cost report. We always talk about the Medicare cost report, and throughout the year, you're paid what is a per diem or a daily rate based on your previously filed cost report. Well, as most listeners know, our fiscal year ran July 1st through June 30th. The cost report, with the assistance of BKD, our auditing firm, was submitted in November, and we had a fairly large settlement that our costs, as obviously were detected in the financials, were running considerably higher than they had run historically. We did receive approximately $1.3 million in the month of February associated with previous year cost information. However, as most of your listeners probably know, the government did provide a cash inflow at the beginning of COVID called the Medicare Accelerated Payment. Obviously, that is now being recouped by the government. So 25% of that $1.3 million was recouped, and so we actually saw about $1,057,000 of that money. However, as we've now turned the page from February into March, because of the fact that the rates have now increased considerably, all claims that had been paid from July of last year through March 24th have now been settled at the additional rates, and so even more money has come in the month of March. Happy to report that, though we talked about those 19 days cash on hand back in January, as of this morning, that number is hovering around 62 days.
Wow.
So a pretty significant change in the cash position of the facility.
And that's gone up since we actually had
Yeah.
the
The board
your
meeting last
calculation
week.
for the board
Yep.
meeting on Tuesday, which was at 53, which is
Right.
the average for critical access
Right.
hospitals everywhere. So
Right,
that's
exactly.
great. So back to, as I kind of say, back to normal, but not really now back to normal. We're getting closer. We're getting closer.
Right.
A little bit of steps. Well, let's go ahead and just touch on some of those numbers from February to let people know that how the weather really did affect
Sure.
things at the hospital. So, Doug, since you already have the numbers all right there, ready to go, isn't he good? We might have to hire him.
So as far as our admissions go, we did only have 70 admissions in the hospital in all the different areas, including med-surg. We saw 37 patients. We only had 7 admissions to our swing bed program in February, and those patients that come in under the observation status, we had 26 of those in the month. As far as the total census days, or heads in the bed, so to speak, 219 days in the month. Again, that's significantly down from our budget. But on a positive note, it was stronger than where we were in February of last year.
We don't even want to remember that one.
Yeah. And so overall, our average daily census on the units, or the inpatient side, was just under 8 days. 8 patients, a day. Moving on to our outpatient and some of our ancillary services, again, because of the weather and the reduction of people being able to get out and get in for those services, our outpatient registrations were considerably down from budget.
Sure.
We ended the month with 1,070 compared to a budget of over 1,600. All of our ancillary services, with the exception of surgery, were also below budget, including cardiopulmonary, lab. Obviously, we've talked about it long and hard. I think we have some positive news about our CLIA that Ashley or Don will talk about. But our lab is still being rebuilt, and we did have 4,800 procedures or tests performed in our lab, and our budget is about 8,500. Radiology services, obviously MRIs, CTs, ultrasounds, etc. We did about 901 of those last month in February, and our budget's about 1,100. Rehab services, similarly weather impacted, only 406 on a budget of 636. But on a positive note, our surgical procedures were above budget, 32 surgical procedures on a budget of 26.
We got those in on dry days.
Yeah.
There were a lot of them in February.
Again, our surgeons are specialists that come from other facilities.
Exactly.
So luckily, the days that they were performing surgeries were better weather days.
Thank you.
And then home health, we continue to look at the home health operations. We were below budget, and I think we are making some inroads in rebuilding that program. And finally, our long-term care residents, we did have just under 16 average residents a day. If that unit was completely full, we would have 18 residents.
Is it are we short of 1 and 1 or 2?
We could have either 1 female and 2 male, or 3 female as well.
Okay.
We actually have 2 possibles that we're going to be bringing in probably in the next
Okay.
week. We're working through those things.
Right.
So.
But there is a waiting list for the hospital for the long-term care. If you'd like to call and let them know and get your loved one on there, maybe they're not ready yet, that's fine, but go ahead and let them get the name on the list, and then if something opens up, they can contact you, and if you're ready, then they can be admitted into our excellent long-term care at the hospital. And anybody that's been there knows it's extremely good care. So, very good.
Fantastic job.
Yeah, they do.
Then moving on to the emergency room area, we only had 516 visits in the ED during the month of February. Again, that was the lowest so far this year. However, if we go back to February of last year, we only had 499.
Yeah.
As far as the dispositions or how the outcomes were for those patients, obviously a lion's share of those do get discharged and go home,
Right.
but we did transfer 19 patients. 55 were admitted to either our inpatient or our observation unit. We did have 17 patients leave against medical advice or left without being seen. And unfortunately, we did have 3 patients expire during the month of February. Finally, our ambulance, again, weather related. We did have 176 ambulance runs in the month. which were 129 patient transports, and there were 47 dry runs.
And that definitely affected by weather when nobody's on the road.
Yeah.
You don't have as many accidents, and then, but it still doesn't preclude them from going out to people's homes when they need them.
Right.
They will be there, and even in the worst weather conditions. And I give them a tap of the cap because I'll tell you what, you would want me on those county roads out there when it gets bad, and they do a tremendous job of getting there safely, and then getting people back to the hospital safely. So that's a job, especially driving an ambulance, because people want to get there right now. But you got to get there. That's the important thing. That's the important thing. All right, Doug. Well, as you mentioned at the meeting, the outpatient registrations and the ER visits the lowest this fiscal year, and as you mentioned, how it affected from last year in the middle of COVID, about February 21, and that was just horrible. But as anybody would know, in February, some of the lab tests, by the way, were reduced because Family Medical Center was shut down early. About 3 or 4 of those days in February, that reduces that, and then of course people just weren't out and about at all. So if they did have anything they could put off, they did.
Put it off.
They put it off, no doubt about that. All righty, let's take a look at the operating statement. Which, boy, when you look at it, you're sitting there, that's just really that's rough.
Well, when you compare,
But I know, but you're going to tell us the good news.
Yeah.
I'm just saying, at a glance, you just sit there and think, oh man, but when you look at all the things that had to happen, and then the turnaround, and then the money's coming in, it actually looks really good on the bottom line at the end of the month.
right, as you might suspect, the gross revenue was considerably under budget with the lower volumes.
You'd have to expect that.
We only had a little over $4 million in gross revenue, and again, gross revenue is not what we're collecting.
No.
Unfortunately, there's
Not even
revenue
close.
deductions.
Yeah.
And revenue deductions for the listeners are things when you have contracts, the government pays not at the billed rate, so to
Right.
speak. There are adjustments that are made, and unfortunately, there's bad debt that's incurred too.
Sure. And a commercial, they make their own deals with the
Right.
hospital. There's
Contracts.
reductions.
Exactly.
So contract pricing. Yes, sir.
Our other revenue was below budget by about $30,000 for the month. We had $127,000 in other operating revenue. The primary driver of other operating revenue is the 340B, which is supported by many of the local pharmacies.
Yep.
But in addition to that, there's some medical records dollars that flow in there, cafeteria dollars that flow in there too. But as we spoke earlier, because of the contracts and various adjustments from those gross revenues, we had about $2.6 million worth of revenue deductions that came off of that gross revenue number, producing a collectible revenue, or what I like to say, your take-home paycheck, so to speak, was $1,635,000. That was about $400,000 down from the budget. Expenses continue to be higher than what we had budgeted. Many reasons for that. But as you can see, we ended the month with about $2.6 million in expenses. So obviously doing the simple math of 1.6, taking away 2.6.
You don't have to do simple math. That's hard math.
Operationally, the facility
Yeah.
did have about $1 million loss for the month.
Yeah.
No secret. Again, expenses were up, revenues were down. But let's talk about some positive news.
I like positive news, Doug. Make my day, buddy.
Again, as we know, this is a district tax-supported hospital. There's roughly around $600,000 a year that come into the facility from tax-supported base. For the month, and most of that money comes in from December through February or March, and it trickles in after that throughout the remainder of the year.
Sure. When people
But
pay
for the
their back
month,
taxes.
for the month of February, we did recognize about $44,000 of revenue or dollars coming in the door, and on a year-to-date basis, we've collected about $540,000 year-to-date. But as you spoke at the beginning of the call, beginning of our talk, the facility did recognize $2.3 million of cash coming in the door between the American Relief Fund, CARES Act, and the cost report settlement. So the overall bottom line number for the month of February was actually a positive number of just under $1.4 million. Again, significantly changing the operations. Again, we're 7 months into our fiscal year. As we talked, the fiscal year begins July 1st. And after those 7 months, the facility is still in the red, so to speak, $1 million, but significantly above where we were at the end of January.
Absolutely. And that's always good news to get that cash back in the bank, so you can do the things you need to do and not have to try and prioritize things because of a lack of cash, and that's the good news. All right, so as we go in the operating expenses, you went over a couple, obviously, that have gotten high. Supplies have gotten higher. Shipping costs have gone out of sight. Anybody that has that, the lab issues with,
Right.
and then the temps that cost a lot more money. So
Exactly.
I'll let you go ahead and
Sure.
run through
Well, just,
some of those.
Just
and-
going through some high level
yeah,
things.
just do the highlights.
Salary and wages were over budget. No secret that we had gone through a RIF, and we did pay out what we call PDO, or paid time off, synonymous with vacation time. And that was a significant dollar amount with those payouts. As far as our physician contracts, again, with the ED coverage and allocation of cost into the ED, we did see a slight increase in that area. And it's no secret with the rebuilding of the lab, we have temporary services from a contract service company. We have a consultant that's providing input to that in addition to RHG. And then obviously we've had to outsource several of our tests to Quest. As we rebuild our own internal, those tests will be processed in our own lab, and we're optimistic that that's going to be returning very, very soon. Many have already returned, but still working out the last few kinks in that.
Yeah,
As
one
you
critical piece of machinery, yeah.
Yes, yeah.
Yeah.
As far as supplies go, obviously the lab and the needs to obtain supplies associated with the rebuild of the lab was significant. We did see a little uptick in our radiology supplies, and obviously pharmaceutical costs continue, not only in our own personal life, but what we have to buy for the hospital, being over budget. As far as the maintenance agreements, some software with the transition. As your listeners probably know, we were looking at Cerner. That's been put on an indefinite pause at this point. But we have support systems that had to be extended until we can upright and consolidate things. And probably the other areas, utilities, just as I think all of us are dealing with the increased cost of utilities, electric cost increase, trash increase cost, and obviously propane, all being over budget for the month. And then finally down at the other expenses, obviously with the various consultant groups that we've had in, the community health assessment, Community Health Care Corporation that came in and did an assessment last fall, paying off and incurring some of those costs were all embedded in the month of February.
You know, when people would just look at a statement, Doug, they have no idea what's in it, and that's why we really hold this program so people get a better idea. It's not just one thing or two things. There's a number of different things in our hospital that people never see. They have no idea how much things cost, and you know, even with the 340 drug program, the hospital has to maintain quite an inventory of drugs in their pharmacy, and I don't even know how much money is sitting there waiting. But there's a lot of these have a shelf life to where they have to have them, but if they can't use them and that shelf life runs out, you had to buy them, and now you have to dispose of them properly.
Yes,
so
sir.
there is a waste factor there. That'd be some report one day. Don't want to really hear it, but I would like to know how many of those drugs actually can't even be used, but you've got to have them just in case. You know, you never know when somebody's going to have that one snake bite that you should never get, a water moccasin or whatever, and you've got to have the right antigen to take care of that snake bite and get them over their hump. So all those things are crazy, but it's all part of operating a hospital. Really is, and there's a lot of expenses to it. The balance sheet, Doug, made me a lot happier.
Yeah,
I tell you what,
the
man.
cash and cash equivalents, as you can see, have gone up significantly. I believe we reported back in January, we had just over about $1.5 million total all in.
Yeah.
As you can see, at the end of February, that number exceeds $4.4 million. As of this morning, again, with continued influx of some dollars, we're over $5 million again. So returning not obviously to where we were a year ago or back when all the COVID money first came in June of 20, but significantly above where we were.
You know, the Medicare acceleration payment was over $3 million.
$3.2 million.
Yeah, so that pumps your budget up, or pumps your cash up pretty quick when you get something like that. But as you're mentioning, it has to be paid back.
Yep.
Over time.
And I might let you know that starting in April, that percentage was 25%. It's now increased to 50%.
Yeah.
So for every dollar that we're getting from Medicare, 50 cents is being recouped by them.
Oh boy, it's playing by the rules, isn't it?
Yeah.
You have to. But when you really look at everything, and I continue to look at our hospital, we have always been a fantastic in the balance sheet of long-term liabilities. Our hospital gets those down quickly to where our debt to equity ratios and things of that nature are usually incredible at Salem Hospital, and they have been for years. Obviously, we were in the middle of construction and when COVID hit and expansion, doing different things, buying new equipment. I mean, it was the perfect storm of expenses all coming in at one time. But the hospital you've already reduced that almost $2 million since last year at this time, and that's incredible. I tip my cap there because it keeps the hospital in good shape with good different ratios. I love ratios. I'm an accountant hard too, Doug. So I sit there and I look at ratios and I'm calculating myself and I'm like, wow, that's pretty impressive. And normally, what the debt for a critical access hospital is usually around 30%, and that's not been the case for Salem Hospital. Most of the time, we've been very, very low. Sometimes as low as 4% that I've seen. I think one year, BKD even said you need to have some debt. I don't like that, but I mean, yeah, I get where they're coming from. You need to have it, so you get more if you need to expand. All right, let's go over the cash flow statement because I really like what I see out of the bottom of this number as well.
Right. As we talked, we started the month of February, ended January, at $1,524,000 of cash equivalents in the bank. Receipts for the month from all the different insurance payer sources, Medicare, Medicaid, other private insurances, self-pay, our home health payments, and everything else, including the clinic payments, amounted to just over $4.6 million inflow of cash in the month. Obviously, we do have disbursements. We have accounts payable.
Sure.
We have payrolls to make, taxes to pay, and then pay down of some of the capital leases that we have. That amounted to $1,700,000 for the month. But on a positive note, our cash position did increase by just under $3 million.
That sounds nice. I like that. Now, unfortunately, back with the CDs, we had to cash some of those in early February because they're not really making that much money, but to keep the hospital liquid, those had to be done, and that may be money may be put back into the CDs later on, but as of right now, there's just six.
As things continue to stabilize, I'm sure the board would want to look at that.
Absolutely. So when the money becomes available that it can be put aside, then they'll go ahead and do that. As we mentioned, the cash on hand, as you mentioned, over 60 days now.
Today it's 62. Yeah.
Good job, guys.
So again, at the end of February, we were at 53. As we talked the horror toys in January, it was 19. So definitely transitioning in the right direction.
The aging of accounts receivable, obviously in the report at the end of February, 81 days, which was basically the same as January. But as you mentioned at the meeting, it was down to 76. And you want that a little bit lower, but we all know it takes between about 55 and 60 days to get money by the time you bill it, get it, turn it around, and come back.
I might make a notation there.
Sure.
We have hired a revenue cycle director. Her name is Jennifer Smith. Jennifer's been with us for roughly 3 weeks now, I believe.
Right. I think the last meeting you had told her
we mentioned
she
that.
was coming in the next Monday
Yes.
after you were here.
Yeah, and she's on board now, and she's working closely with RHG and their revenue cycle leader, and have made several changes and will continue to make increasing changes.
All right, very good. I'm going to move this a little bit closer because I know. Don, you don't mind that spring in your face there, do you?
No, not at all.
I didn't mean to do that, but I want to hear Ashley's dulcet tones so we can actually hear. But she's going to give her report on acute care and the staffing and the acuity. And tell us a little bit about that, Ashley. Ashley Sullins has joined us, by the way, from the hospital. Ashley, Chief Nursing Officer.
Yes. Thanks for having me.
CNO.
Thank you.
I remember you just as a regular person, a plebeian at the hospital, But hey, how long you been at the hospital now?
About 8 years this
Okay.
time around.
Yeah.
I've worked there, about 3 different times.
Yeah.
But
Well, you've done different.
first time working there was back in 2000 probably, and I've worked away from there maybe a total of 5 or 6 years. So several years altogether.
Well, we're glad you're here.
Yes,
We
I'm
do
glad to be here.
appreciate that. We do appreciate that. All right, so as Doug was alluding to in his report, and obviously I don't think it's a surprise to anybody. February was a down month, but down for patients. We had such bad weather conditions that it does affect everybody. And even though people probably should be in the hospital, may not be there because they can't get there.
Right. We were a little bit, actually, about average from what we've seen normally, but another challenge that we had back in February was also the lab situation. So that did, prevent us from accepting some of the patients back on the floor.
Understand
but
that.
we're getting back up to par there. So back in February, our average acuity per day was 20, which the average acuity means how sick the patient is. So each nurse was assigned to an acuity level of 36 per day.
Okay.
So our average acuity was 20. So that means we were kind of in the middle there with the level of sickness that we were seeing from the patients coming in.
Okay.
Our average patients per day was 8. We saw anywhere from, we had an average census anywhere from 4.5 to 10.5 per day, with an average acuity anywhere from 12 to 35 per day.
Okay.
I think we're going to see an increase in that in the month of
For the
March.
month, I would assume so,
Yeah.
yes. And then it will just probably continue to go up once everything gets back into full swing in
Yeah.
April.
As a part of RHG being here, we've really worked hard at getting our swing bed referrals up. We want to keep an average of 6 in our hospital at all times. I believe for the month of March, we have accomplished that goal, minus maybe a day or two. So that's really helping with our revenues. And I believe right now we currently have 5 in at the time, and we've been as high as 8. So we're really, that is keeping our total census higher as well.
Well, let's remind people, Ashley, you may go get surgery in St. Louis, Springfield, Columbia, wherever. But if you want your rehab done here, if you want to have that done here, you can come back to Salem Hospital and get it. You don't have to stay in Columbia, St. Louis, or Springfield. And that swing bed program here at Salem is going to make it a lot easier on your family because you're here in visitation. And by the way, they have changed the visitor policy at the hospital, which I'm sure we're going to touch on here.
Sure.
I got that email last night. But anyway, it makes it easier. You don't have to try and drive that long way. Then you're kind of subject to whatever restrictions those hospitals have about allowing visitors to patients. It just makes it easier on the family. And really, you're going to get better care because everybody here, you're going to know somebody who's taking care of you. I remember when I had to go in the hospital, I knew half the people who were coming in to see me. It's a lot easier. They like to want to talk, and then they want to visit, and it makes you feel better. And if you feel better talking to somebody you're going to heal quicker.
Yes, that's true. And speaking of the visitor policy, we have relaxed that since our COVID is down in the community, and that took effect yesterday, actually 2 days ago, March 22nd. So our hours of our inpatient visiting hours have changed from 8 a.m. to 8 p.m. Monday through Friday. Saturday and Sunday, we have opened it up from 8 a.m. to 6 p.m. We're not limiting visitors like we were with COVID. We still have some restrictions in
Sure,
place.
yeah.
It's just been the routine policy that we've had for years, and we're basically going back to that policy. Now, if we do see the COVID rise in the community with a positivity rate greater than 10% or 40 cases,
Sure.
we will kind of take that
Tweak.
back down a little bit.
You'll tweak the
Because
policy,
our
yeah.
number one concern is keeping the patients safe.
Sure.
So, but for now, I'm happy to be able to report that.
Yeah, and that was great. I was glad to get that from Jason on Tuesday night when I got back from the board meeting. He was waiting for me. I thought, oh, look at this. This is great. Anyway, it's wonderful news, the visitor policy. If you have any questions about the visitor policy, you can go on smdh.net. The entire policy is there, and the certain qualifications. If somebody does have COVID, there are still some conditions there that
Absolutely.
are different than just a normal visitor policy. But smdh.net, and if you have a question about that, maybe you don't understand that, just call the hospital and ask them about it, and they'll get you somebody who can answer that question for you.
Yes. Yep.
All right. You also graced us with the home health report. Now, you're used to doing this because you have a lot of history in this. And home health has always been a real positive strength of Salem Hospital. I'm going back into the 90s. It's always been a very positive part of our hospital. That has not changed. Still a very strong asset, even though somebody can't do a graph very well.
I'm not taking
That
responsibility for
graph,
that.
I looked at that graph and I said, are we supposed to look at this in 3D? Like pushing it forward? But I believe it was not correct. No, and if anybody would see this graph, they had the wrong one at the wrong place. But anyway, nonetheless, patients.
That's the right numbers there, and that's what
But
counts.
you're going to give us the patient survey results. These have to be done every 6 months. Right? Is that correct?
Yeah, we report this every 6 months. This is an ongoing number that we
Sure,
see.
never stops.
Right. Our overall rating of care is 92%, with a Missouri average of 89.
Let's remind people it's from July of 21 through December of 21, so it's not as of the end of February.
That's correct. Our likelihood of recommending is 79%, which the Missouri average is 82. Another thing that kind of goes into play when you see these results is the number of surveys that were submitted.
Sure.
And we were a little bit low on the number of surveys. They like 30 to be turned in, and we were under 30. So some of these might be skewed a little bit because of that.
Okay.
The care of the patients, we're at 92% with a Missouri average of 91. And then that's all we've reported this last 6 month period. Usually we report a few more things, but the Home Health Compare website, you can go on there and you can look at all the results from all the home health in the surrounding areas. They have suspended those results for now. So there's some of the data that we used to report that's not available.
Sure. And that always usually had Salem at the top or right near the top in this area.
That's correct.
Yeah. So for anybody that wants to know, yeah, our home health is outstanding. All right, very good. So, but there have been some rule changes in home health, and you brought those up to us here almost a year ago. They're going to make changes of how it's billed and different things of that nature. You want to just touch on that a little bit, Ash? I don't want to take too much time on that.
Yeah,
but if
just
you would.
a quick little summary of that. About a year ago or so, the way that home health was paid was we would get about 60% of the payment up front, and then we would get the remainder of the payment after a 60-day episode. They did kind of break that up to two 30-day periods, where it was kind of the same way, and now they've went to only paying us once the service is over after 60 days. So we fill out what we call a notice of admission in the beginning, and that just says that they're on service, and then Medicare will pay us when the service is completed, each certification period, which is every 60 days.
Okay, so a little bit different now. Now the hospital's waiting for their money again.
Right.
Doug loves it. Just waiting. Just that waiting game, Doug. It's gonna turn you gray, man.
It's going great.
Yeah, I know. It's already started. I get it. So now, one of the things that you did bring up is some the Medicare update, excuse me, about not accepting orders from nurse practitioners and physician assistants anymore. That went into effect. When did that go actually into effect?
December 31st.
Wow. So that's really
The waiver ended. This was put into place because of COVID.
Sure.
So that COVID waiver ended December 31st, and now we're back to the original rules of only being able to accept orders from MDs.
MD. But you said that that's still possible. They're kind of in
That's
legislation. And
That's correct.
the legislators are meeting, kind of hovering over that. Not really. They're still working on districting maps and things of that nature. So that's part of that. And is this a state-by-state thing, or is this just with the federal government?
It's a state-by-state thing.
Okay. Very good. Okay. So we, like you mentioned, the star ratings aren't there, the quality measures aren't there, those reports aren't there. Sometime later this year, I'm sure we'll start to see those again, probably on the next report, you would think. Maybe from January to June. That comes out, that'd probably be in August or September.
I would
You would
hope so.
think so?
I would hope so.
Okay, very good. Those are always great. There has been some staffing changes, though. You want to touch on those very quickly?
Yeah, we're doing a lot of things out of the hospital. We're trying to shift nursing staff to try to cover in multiple different areas. So we've pulled some of our home health staff to train on our med-surg floor. We've done some changes like that. We actually have a couple openings in our home health department right now. We have a full-time home health director position that's opened, and also a full-time RN case manager position. We're in the search for that. So those are some other new changes that have come up recently. But we're trying to, be very efficient with what we have going on over there. So some of these changes have happened because of that.
Okay, very good. And the infection control numbers, for the most part, very good, except that July through September had 4 instances of a urinary tract infection in September. It kind of threw those numbers into a tizzy, didn't it?
Right. That's one of the things that we monitor is our infection rate. Our goal is to stay under 5%. And we review that each quarter. So July through September, we were at 7% total. In October through December, we were at 3%.
Okay.
It's looking like we had 8 total infections for that July through September time frame, and then we had 3 total infections October through December.
Yeah, and then you were asking about nurses and how many nurses are at the hospital. You don't have to, unless you didn't write it down. You don't have to go over that, or did you?
I do have it.
Jeez, you're getting efficient. I
I'm
have
telling
trained
ya.
you well
Oh, you have you?
for the radio stuff. For the radio stuff. I'm going to change you for your job.
So the other positions that we have open within the hospital is we have day and night positions open in med-surg. We also have full-time RN emergency department positions open, and we also have some positions open in dialysis. We have a surge tech position opened in surgery as well. That's a very key component to our surgery department and us having the ability to perform surgeries. So we're currently looking for a full-time surge tech.
Okay.
So we do have several opportunities if people are interested. We've just implemented a sign-on bonus of $3,000 for RNs. And if I can go ahead and add,
You go ahead.
lab, we are currently looking for MTs and MLTs for our lab. So we're offering $3,000 sign-on bonus for some of the positions that I've just mentioned.
Okay.
And we've implemented also a referral bonus for our current employees. So any of our employees that bring a staff member in
Sure.
will also get a $1,000 referral bonus.
Oh.
So we're trying to get up there and be competitive. We've also adjusted our nursing rates. We're looking at those rates first. And then we're going to go through all the departments in the hospital and take them one by one and see if we're where we need to be, and hopefully adjust those to be competitive to the surrounding areas. So we started with nursing and we got that approved. And so if any nurses out there interested in working, please give us a call. And lab,
Yeah.
absolutely.
Yeah, and lab. Yeah, because
It is a great place to work. It really is. I know we've had some challenges, but even through those things, it is a great place to work.
every business goes through a little cycle.
Yes.
And as we mentioned, this was hospital probably deserved a better fate, except COVID threw its ugly head in there at the time of expansion. Put in an MRI, you had a sewer problem. I mean, what else? You don't even ask what else could go wrong, because it probably would have. And it's just one of those things. And then you get some of this crazy weather we've had, and that doesn't help out the situation at all. And then we all know the situation with the lab, and that kind of threw everything else behind.
And that's
a little bit, too.
that is getting so much
Yeah.
better. We're on the mend on that, I would say. We're getting close.
So,
With the delivery of the new technology,
yes, sir.
we'll be back at where we were before.
Wow, he just took off there, Don.
Yeah.
That was pretty cool. I'd never seen that on that one before. But you go ahead.
So, the equipment should be in the first, actually, it's to be delivered on the 4th of April. And I think by the last week in April, we'll have it up and operational.
Right.
We have to, dial it in,
Sure.
do all the standardization of it, and then we'll be ready to go.
Got to calibrate all that equipment, don't
Yeah.
you? Yeah,
Yeah.
and that takes a little while. And then CLIA will come back in and then do their final
Resurvey.
look-see and
Right.
certify. And then once they do that, then Salem will be back to every single test
Absolutely.
offer that they did before. They'll be able to do again.
Yeah, and we don't anticipate any issues with that.
And that's the good news. Well, that's a
Yeah.
brand new piece of machinery, by the way, the Vitros Chemistry Analyzer.
Right.
I'm sure it didn't cost much, right, Doug?
Well, we structured it so that it's going to be paid for over a period of time.
Well, I understand that, but I mean, I'm sure it was just like $8,000 or $9,000 total.
Plus a little.
Yeah.
So Doug, that
Gee,
saved us, we saved by updating it, how much was it? We saved.
Over the 7-year period, approximately $380,000.
Yeah. So that's for new equipment.
Yeah. Oh yeah. Oh yeah. Equipment and it's out of sight. And then I'm sure the shipping of that was cheap. Okay, we all know about shipping anymore
Yeah.
and what the price of gas is. And, you know, they add it on. They don't take it out of their pocket. It's going to
No,
get
they
added
don't.
on to the buyer. So you better be ready for that. So while I have you here, Ashley, I'm going to throw that back over to Ashley for a minute, Don, because we have a community health needs assessment.
Right.
And that's ongoing now, by the way. It's on the hospital website if somebody wants to do it, but it's also available in paper copies as well.
Yes.
Hopefully that doesn't come up and smack you.
This is a dangerous situation right here.
Yeah, well, it's calisthenics. So, back and forth. That way you get that.
Yes, our community health needs assessment. We are required to do this every 3 years as being part of the critical access hospital.
Right.
We have our first meeting with our committee Tuesday, March 29th. I have went out and distributed paper copies at local financial institutions, healthcare offices within the community, and they also have little flyers out there with instructions on how to go online and submit this survey. The more responses, the better, and that way we can identify what the community perception is of what our priority healthcare needs are. So we're hoping to get quite a few of those. Again, like you said, surveys are available online. The survey is going to be open until April 15th, 2022. And so after that, we'll start compiling the data and see what we can come up with.
You and your survey monkey going to get together and do
Yep.
that? Okay, very
That's
good.
right.
All right, so the community health needs assessment, is it at pharmacies? It used to
It
be at
is.
pharmacies. Okay, we'll make sure you have
Pharmacies,
healthcare offices, but I don't truly call a pharmacy a healthcare office.
The different physician clinics in town,
Right.
Mercy, Phelps, Four
Rivers.
Four Rivers community.
You have it over at Compass?
Yes.
Okay.
So all of those different areas.
Okay,
we've,
very good.
we've,
All right, so
taken
you have the
surveys
paper
out.
copies there. You can go if you don't want to get out, you don't have to. And in these last 3 days, who does? SMDH.net. Just go there, and it has right below the top bar, you'll see Community Health Needs Assessments. And
And
own
it's
little
also
bar.
available on the Facebook page as well.
Okay, so very good. So you can access it a number of different ways. I'll say it'll take you about 5 to 8 minutes.
Yeah, it's not. It doesn't
22
take long.
questions total. Of those, most of them are multiple choice. I like multiple choice. It's easy. So you can go through those, read it, check it off, and you can actually submit that online right there. You can just click it off online and hit submit, right?
Yes.
I didn't do that last night. I was going to do that last night. Well, I was searching other things. Actually, I was putting the story together that you actually have this out. So I want to make sure we had
That's
that
your
out.
homework for tonight. How's
Yeah,
that
well,
sound?
no, I already did it.
Oh,
Somebody's
okay,
in
you've
there
done
waiting.
it
But we'll probably do a radio commercial on that too, so we get that out there and out and about. All right, very good. All right, let's go back a little bit. I'm gonna let Don talk a little bit because Ashley, you have dominated that microphone.
Okay, I'm glad to have you.
But
Give it away.
and I know
She does a great job.
she does a great job. She's incredible, and both her and Bobby have done a fantastic job for our hospital. And thank you for doing what you do.
Agree.
You know, you should have brought your daughters to our basketball team, but we're not
We're not going to talk about
not
that.
going there.
All state. Did you see that?
I don't want to hear it. I don't want to hear it. I don't want to hear it.
I won't say
No, you go right ahead. You should be a proud parent.
Yeah.
It's a great accomplishment. It really is. All right. So let's talk a little bit about our marketing and community perception, Don. I'm just going to touch a little bit on that because Dr. Tiffany Bland is now going to be working with our Dent County Health Center over
Right.
here for the Show Me Healthy Women, and talked with Zach Mosier about that the other day. And so we really want to get that word out. So a lot of the advertising people are seeing have that out there, but also our clinic,
Right.
SMDH Family Clinic. Family medicine, actually, is what it's truly called. And so we have 3 outstanding people there that can take care of you. You got Dr. Al, and of course we got Terry Bruno, and now Dr. Bland has come on, and
Right.
and she does a tremendous job. Had the opportunity to talk with her. Very smart, intelligent young
Very,
lady.
very knowledgeable physician. She'll be a great addition to the community. She'll provide services probably we haven't had in a long time. I've been very
Don wants
impressed
to
with
bring
her.
up some even more positive news
Yeah.
about providers.
Wow.
Yeah.
I wasn't ready for that one, but Don,
Yeah.
you go right ahead and interject.
Well, Michelle Bland, nurse practitioner, starts April the 4th, and she'll be in the clinic. New provider. It's kind of interesting. You see a mother and daughter. Mother being a MT and the daughter being a physician.
Yeah.
So I think that's a good combination for the community. I think it'll be a huge benefit. And Tiffany, as you said, is going to be working with the Show Me Healthy Women's group, and I think that's just brings more services to us as a community. And and that's what the hospital needs to be doing.
Absolutely.
It's we want to grow with the community and provide more services so that we can bring more people in, and we don't have to go through these issues again with the restraints with income and things like that. If we grow, and we grow in the right way, the income will come with that. And so our goal is to, kind of evaluate the areas where we need to make improvements. We've done that. You've heard Doug's report, Ashley's report, and I think we're making a lot of progress. The thing I've been impressed with is that we have at the hospital a great team of real professional members. We've had to turn down some positions, which was that's always tough to do. But I think from that we've got a lot of people that have really stepped up, and have put in more effort. Doug's worked with them a lot, trying to train them how to manage their budget so that on the income statement and the expense side, we know we're in line. We know where we need to be close to budget. So that's been a big focus, and that's always a focus. It'll never go away. So I think the success we're having now is because of the effort that people have put in to improve where we were at. And the hospital over the years have treated a lot of patients. We want those patients to come back. We're always out looking to expand and bring new physicians in, and that's going to be a focus as we move forward. Certainly looking at the possibility of maybe a walk-in urgent care clinic that we can do here in the community, and I've started doing some work on that and using some of our staff in Kansas City to help with the demographic information.
Okay.
We can look at that now and see where, from a federal standpoint, and the state standpoint, from the clinic side, and see where people go if they're referred out, why they go there, what kind of condition they have, and then we can look at how that affects us and how we can bring physicians in to keep those people there.
Right.
So that's a big component as we gear up to keep money here and not send it out. There's always competition. And that's you just have to bill for that. I think competition, from my standpoint, I like it. Because I think if we can do a better job, we get the business. And that's our goal. And I think I don't think we have, I know we have the ability to meet that competition and provide the service. Very excited about where we're going.
As you mentioned, when you do put competition it makes you strive to get better, and that's what you're saying. And
Right.
it's just like any sporting activity. You don't want to keep losing to the same team. You want to rise to their level, and
Right.
actually you want to exceed their level.
Absolutely.
And I know that's what the team has had to do here from RHG. It's no, you're right. It's never pleasant to come in and have to reduce
Right.
staff in any way, shape, or form. And I hate to see that, but we knew that some things were probably overstaffed in some locations, and there had to be a little bit of trimming and stuff of that nature. But and the hospital will grow, then a lot of these people,
Will come back.
as things start to develop and take off again, the need for those people will be back
Right.
again. And so
I think we brought some back already.
yeah, and I understand that you
Yeah.
already have too. So that's why I want people to understand. It's not just because that the one initial cut was made. As Bill mentioned the last time we were here, as the need arises, some of these people will be brought back.
Absolutely.
You know, and that's the neatest thing that we can have
You know,
going
our
forward.
focus was to right size, you know, and really get us where we're not spending more money than we're bringing in. As Doug talked earlier, you know, that was a real issue, and I think we've got a pretty good handle on it. We're not really where we need to be yet, but a lot of that is looking at contracts and other things that affect us as well.
Well, a lot of that's still all coming up, and
Yes.
there's a lot of different things that have to happen in the very near future. So we know that the lab, is, as you mentioned, April 4th, we'll have that analyzer in. 2 to 3 weeks, they'll take to calibrate it. So as Bill was mentioning at the meeting, and he mentioned at the end of the month of April, it looks like everything will be back to normal. Last time we talked with Bill, he was looking at trying to get the health fairs back. Obviously, can't do that until you have your lab where it needs to be. But and I think a lot of people out there are looking forward to that, and that will reassure them our hospital is right back to normal. I know COVID eliminated that. Ashley, you know how popular those were. Where it didn't eliminate it, but it forced people to come to the hospital in a 15-day period instead of one location for 2 days for 4 hours, and you get a lot of people in there. But it was not only just the lab work that was done; they had a chance to see other services the hospital offered, and I think that really helped. So, very good. That's just part of what has to happen, isn't it?
It is, and you know, we're looking at some new equipment as well. We're looking for a new CT for radiology, and haven't made that decision on purchase yet, but it's something that'll save us money by going with a new machine.
Sure.
We can do more modalities with the new one what we currently have.
And one of the things too that there is now on every I'm thinking every hospital website, or supposed to be on every hospital website, the opportunity for you to kind of do a little shopping for the services that you want to do. So it's supposed to be transparent. Anybody that ever takes and looks and see what the Salem Hospital charges are for certain services, you're going to find that they're going to be some of the lowest in the state. And somebody said, yeah, that's because of the quality. Well, we have the newest MRI with one of the lowest prices in the state. Now, when you start thinking about that, when you got the best, you got a 3D mammography machine out there that they don't have at another hospital. It's not even very far away, and it's less priced than theirs.
Right.
So look at those services. You have that right to do that. Just go to the hospital website, smdh.net, and look at that. The opportunity to take a look at the transparency costs of what those services will be, and then talk to your physician. Make sure that what you're looking at is what you have to have, obviously. But you know, why if you can tell your insurance company, look, I'm saving you money. I'm not going to that St. Louis hospital. It's going to cost you $5,000. I'm going to Salem Hospital. It's going to cost you $2,100. You pay it all. Why not? Because they're going to pay over $2,100 up in St. Louis.
Yeah, absolutely. It pays off to check the sites on pricing.
And you can negotiate with your insurance company. People don't think they can. If you already know what service you have to have, you can go and shop and you can find something and say, look, this is what my physician says. This is apples to apples. I would like this entirely covered. I was going to have it in St. Louis. I'd like it to have it here. Sometimes you can get that. Maybe not all covered, but maybe 90% instead of 70% or 60%. That deductible that comes out of your pocket hurts. Because those deductibles now are a lot higher than the $500 or $2,000 deductible years ago. I think mine's still at $6,000. You know, some people have $10,000 deductibles, and that's a lot of money to have to come out of your pocket. But these are just great services our hospital offers. Still a very affordable hospital. And then we talk about the swing bed. If you have a chance to come home, our services are just as good, if not better, than anybody you're going to go to. I went through this when my father was going through rehabs and things of that nature. And I said, you got to do one more. You're coming to Salem. I'm taking you to Salem because what I see here doesn't even compare. The attention that they get is not the same. So take into all considerations of what your local hospital offers you.
You brought up rehab. We have a great rehab department. They do exceptional work.
I think it's rehab month next month, isn't it?
Yeah.
I think Gina will be here.
All right.
I think rehab next month. So I always love talking to Gina because she just keeps us up to date on that. And our rehab department is top notch.
Yeah.
They are fantastic. Gotta love those girls, and they are very, very good. Very, very good. at
Very
what they do.
committed.
Very good. All righty. Who wants to talk about our meaningful use update? Is that you, Don, or
You want to do that, Doug?
does Doug get that one?
Well, I'll take a shot at
All
it.
right, Doug, take a shot at it.
Again, as part of the government, we have to provide information with the support of RHG and some of their IT folks. We're looking at communicating and making sure we're up to snuff on providing all the information accurately and timely.
All right. So because of what the hospital has gone through, they're not going to even try to attest in March.
Correct.
Doesn't even make any sense to try and do
No.
that. You're not gonna. It's not going to work.
Right, and again, we've had support from the RHG team and their IT experts who have worked with the government in other locations throughout the country, and that is their recommendation at this point in time.
And the board did accept that recommendation to file, if I remember this right, an extreme and uncontrollable circumstance, and that will be done later on in the year, and then the CMS looks at that on a case-by-case basis. But the
Correct.
board did agree to go with that
Yes.
idea and that policy or philosophy at this time, simply because of what they had to go through. I like to say that it's wonderful to hear the name Tabitha Standfast again. Tabitha does so much for our hospital. It's incredible, working with MRPC and everything else. But she's going to be the one, the Delta Regional Community Health System Development Program. She's going to be the coordinator for that, and you couldn't pick a better person than Tabitha Standfast. She's fantastic. I haven't seen her in 2 years. She hasn't come in and interviewed in 2 years. I miss
Get
her.
down here.
Yeah,
better
I
call
miss her. I always liked Tabitha. She's always good. I
Yes.
really enjoyed having her.
So as part of her duties with the Delta region
Yeah.
and communications, I'm sure she'll be here doing a radio
I'm,
spot
well,
with you.
I know. I'm hoping she is. And the only other thing we want to just talk about is the hospital, knowing that the City of Salem's sewer line and the water extension, everything is now out of the hospital. Of course, they were on city water, but the sewer extension is now ready to go. We're supposed to test the lift station. They're getting a bigger one now out there near the hospital. They're supposed to do some testing on one of them yesterday, and I'm not sure with all the rain and everything if they did or
Right.
not, but they will be doing that test. But there is a lagoon issue. The lagoon is the hospital. Nice little pond back there, in case you want to know why there's a pond. But that lagoon system is an aerated lagoon, and it has to distribute the different types of waste materials that go through there. That's under DNR regulation, and so there has to be a proper way that it has to be closed. And so the hospital did get a price on what it would be to get a plan together for that closure, not to close it, but the plan to get that closed. And so that was like $4,600, right? If I'm not mistaken. So that was about it for in the closed session. Any votes taken? Just pretty much just discussion inside closed session.
Yeah.
That's
It was-
okay.
It's a good meeting. It's a
Yeah.
good discussion.
Very good.
I think the thing that's important that could be reemphasized is what Ashley was talking about with the retention bonus and the sign-on. And we have to find RNs, the lab people, to be able to expand what we do.
Right.
And it's very critical because there's shortage everywhere, and they're just difficult to find. We're doing our best. Ashley's put a lot of time, and our HR department has as well. So I think you hired a couple yesterday, didn't you?
Yes, yes, we are slowly finding some, and we're not where we need to be, but
No.
I don't know if anybody can hear me.
Well, probably not.
Yeah, I said we're slowly finding them, but we're not where we need to be yet. But with time, one day at a time, right?
It is that way. And in all honesty, with I'll say 18 months of just COVID, HE double hockey stick, a lot of people that were in healthcare during that time has had enough.
Right.
They were expected to perform miracles on something nobody knew about. they were put through all this pressure, and then as soon as they get through all that, then all of a sudden they're forced to get vaccinated to keep a job. And I thought, if you don't talk about a slap in the face of somebody, when you really need them the most, they were there, didn't question anything, and then now that it's started to slow down, now you're going to have to be vaccinated. Now this is going to happen. I thought, I could see why people had had enough and wanted to get out. Now that was before. Now maybe after a while they'll realize they miss it a little bit and want to get back into it. And hopefully that will happen, because there's a lot of qualified people that actually got out of the healthcare.
Oh, absolutely. Yeah. I think some of them will come back. I'm not sure about all of them.
No.
Yeah, there's been employees that have quit and went to work in insurance or other areas. They just don't want to be in healthcare right now.
Yeah.
It's been
But-
overwhelming and stressful.
But as things get maybe back to near normal, Ashley, I think then it becomes more of a consistent, you know what you're going to do when you go in that thing. Well, you never know. In a hospital, you never know. It's just like radio. You walk in, you have no idea what's going to happen.
No,
You
that's
know,
true.
you have no idea who's going to walk in the door. I thought it was the Don and Doug show, and then they brightened it up with Ashley. You know, it's
Much
great.
better looking.
Much better looking.
We had to improve it.
Well, not bad with you guys, but definitely a huge improvement with Ashley. But you know, well, I mean, we always enjoy everybody from the hospital coming in, because there's something to learn from every single different department, every single person that does it. It's a unique opportunity for people to hear about things that they don't normally hear about, and that's why we do these interviews when I have our spotlight on the hospital. Ashley's done that many times, and we talk about all kinds of different things, and not necessarily what they initially came in to talk about. We sometimes venture off a little bit, because there is something that's very important that people need to know. You know, our hospital provides a number of different services, so many that they're not even all listed on the hospital website.
Right.
You know, there's just no way. So real quick, and I know you guys got to get going, so let's remind everybody, the SMDH assessment, the health assessment, is online at smdh.net. Also, you can check things out there for employment, right? They also have that on there as well, correct?
That's correct.
If you have any questions about what Ashley talked about with new opportunities or bonuses, can they call you?
They can call myself or HR
Okay.
at any
And-
time.
And the number to call, if they wanted to call you, would be?
573-729-5917, and my extension is 4030.
Do you know what the HR's extension is off the top of your head?
You can dial same number, and extension is 7006.
What a memory on that girl. I'll tell you what, no wonder why you brought her along. Got that. So if you're looking for that position, and there's a number of different positions, actually go on smdh.net, take a look-see. Also, if you want to figure out what the new visitor policy is, pretty much back to the old policy. There are still a few tweaks in there. So if you want to see that, it also is on smdh.net and on the Facebook page.
One thing to remember about visitors, we still are requiring them to wear a
Mask.
face mask
Yes.
when they come into our facility.
Yeah, you still have to mask up. Yeah, I even wrote that in my thing. You still have to wear masks. But yes, but it's great that the visitor policy is back to more than one person, and for a short period of time, and people can see their families again, and that's huge when you try and get healthy again. And SMDH was no different than any other hospital. Everybody had their own protocol when it came to the COVID situation. So now getting back to normal.
Yeah.
We're close.
Just to add to that, there's been 0 positive COVIDs in the last week or so.
In the
the
I haven't
community,
talked to
so-
Zach here lately, but he was saying that in one, I think, in the last 12 days.
Yeah.
I like that. Yeah, let's get rid of that thing.
Let it go away.
Let's put it in the ground somewhere and leave it.
Yeah, I believe the positivity that we
Is
reported
zero.
this morning is,
Oh, was it a
is
little bit up?
just it's below 1%
No,
for,
yeah,
for
I
Dare
think
County.
there's still a case out there.
Yeah.
So, very good. Very
Thank
good.
you for the opportunity.
Don,
to be
thank you
here.
for coming in. It was a pleasure meeting you, sir. And
Thank
as
you.
we visited earlier, where I know I saw you Tuesday,
Right.
but we'd seen each other before that.
Right. So, we have a lot of great people at the organization, and we need to bring some of those people in and let them visit with you.
Well,
we go
actually
along.
there is a spotlight on. I know you're new to our area. Every Wednesday at 9:10, except for when you guys are coming in, we actually spotlight a department.
Good.
And we have some that have been scheduled. There's still some openings on that schedule, but we've had everybody from maintenance all the way through to the end, so people get an idea. Ashley's been here a number of times. Her husband Bobby's been in a number of times. We've had Lab in, obviously not lately, because we've been a little, first off, short-handed. I don't even think we could take a Lab person out there and bring him in, but that will be a very welcome addition when we actually have enough personnel that somebody can come in and just explain what they have to do in a lab. And,
I think ERs are
and-
an area that people are confused about, how they get in, how it's used.
Yeah.
I think that would be an area to be good to talk about.
We welcome all. And over a period of time, God, Ashley, we'll be doing this. I've been doing this, 13 years in the hospital now, so we've interviewed quite a few and different aspects of what the hospital does. So we really want people to understand exactly what Salem offers, and that's our goal. Our hospital is so a key ingredient to how successful our town can be.
Absolutely.
Without the hospital, you can't grow, and so you definitely want to make sure that you understand that, because those services that they offer, if you have an immediate need, you don't want to be having to travel 35, 40 minutes
No.
to get an additional 35, 40 minutes to get service.
Right.
Especially with everything our hospital has gone through with the STEMI program and different things that they have done to increase the rapidity of which they can analyze you, check you, get you out, and out you go. The moving of air evac to the hospital campus, a huge thing. They even sped that up even more.
Yep.
So we've seen a lot of improvements to our hospital, seen it grow.
A lot of great services.
Yeah, I was here before they had long-term care.
Were you?
Yeah, I was here when they built the long-term care on the hospital,
That's
and that
nice.
was, so I've been here a while. Just
It's
a
nice
little.
to have that history, though.
Yeah,
So you can talk about
Yeah.
the growth and the change.
yeah. Well, no, I mean I've watched POB 1 being built, I watched POB 2 being built, and I watched POB 3 being built. I've seen the entrance move in the hospital 3 times. I've seen the expansion of the emergency department. I've seen the building of the ambulance garages and stuff of that nature. So I've seen a lot of different changes in the hospital, and a lot of them have been for the good. Now, of course, with the new MRI and things of that nature, it just continues to get better.
Right.
It really does. I'll let you you guys got to go. Y'all
Thank
got
you.
work to do, man. I can't keep you here. Thank you for coming
Thank
in.
you.
Don, Doug, Ashley, really
Thank
appreciate it. Our spotlight on the Salem Memorial District Hospital. Please stay with us. We have coming up in just a moment here at KSMO Radio, our civic happenings. They are next, right after this.
Hey, it's Linda O'Brien with the Countdown. Now, last week, Chris Young and Mitchell Tenpenny debuted in the top 30 with